In this video, we will have a detailed discussion about the pathology of endometriosis. So what is endometriosis? Endometriosis, as the name implies, is the presence of endometrial glands and stroma in a location outside the uterus. So endometriosis is the development of endometrial tissue outside the uterus. Now, as far as the pathogenesis of this endometriosis is concerned, there are four theories that explain the pathogenesis. The first and foremost theory, that is most accepted one, is regurgitation theory. What is regurgitation? So let me explain. So let me draw uterus. So during the end of menstrual cycle, what happens? That the endometrium lining this uterus sheds through blood, that is called menses. But in endometriosis, what happens? Sometimes this endometrial tissue that is usually shed at the end of menstrual cycle regurgitates from this fallopian tube out of this fallopian tubes into the pelvis or abdomen. So this regurgitation of this endometrial tissue causes implantation of this endometrial tissue outside the uterus. This is called regurgitation, and this concept is called regurgitation theory. So regurgitation theory is one of the theory that explains endometriosis. Other theories are benign metastasis theory. Benign metastasis theory indicates that endometrial glands and stroma that line the uterus sometimes spread through the blood vessels and lymphatic into the other areas of abdomen and pelvis. So simply they spread through lymphatics or vessels. This is called metastasis, but obviously this is not a malignant condition, so we call it benign metastasis theory. The third theory is metaplastic theory. This theory states that the serosal cells that line the abdomen and pelvis, these cells undergo metaplasia and transform into the endometrial tissue. So this metaplasia explains metaplastic theory. And the fourth theory is extrauterine stem or progenitor cell theory. This theory states that the progenitor cells from the bone marrow that are circulating in the blood implant at the level of abdomen and pelvis, and they differentiate themselves into the endometrial tissue and stroma. So this is called extrauterine stem or progenitor cell theory. So these are the theories. These theories explain that how does the endometrial tissue develop. But another part of pathogenesis is that once this endometriosis develops, how this endometrial tissue keeps itself sustained in the environment outside the uterus. So actually endometrial implants are composed of endometrial glands and endometrial stroma as well. So this stroma is functioning, and this stroma releases some pro-inflammatory factors that causes activation of macrophages in the vicinity of these endometrial implants. Now when these macrophages are activated, they cause an increase in the expression of COX-2 enzyme. This enzyme helps in the formation of inflammatory factors like prostaglandin E2 and other inflammatory factors. These inflammatory factors in turn act back on the endometrial implants and enhance the survival of these endometrial implants. So you can say that these endometrial implants are interacting with macrophages to release some pro-inflammatory factors that enhance their survivals. Another mechanism is that these endometrial implants themselves release some prostaglandins that help in their survival. The third mechanism is that these endometrial tissues express an enzyme aromatase which helps in the production of estrogen hormone. And these endometrial implants themselves are also estrogen responsive. So when estrogen acts on them, these endometrial implants grow in size. So you can say that these endometrial implants are hormone sensitive and they grow by the help of this hormone estrogen. So these are the ways in which these endometrial implants enhance their survival in an environment in which they were not supposed to develop in the first place. So this is the pathogenesis. Now let's discuss the morphology of endometriosis. As far as the gross features are concerned, you will see red-brown nodules or implants. Why you will see red-brown nodules or implants? Remember that these endometrial implants are functionally active tissue. So whenever the menstrual cycle progresses, then at the end of menstrual cycle, you know that the normal phenomenon is that the menses happen, the endometrium tissue sheds from the uterus out through the vagina. But these endometrial implants are not connected to the genital tract. Rather, they are present in the abdomen and pelvis. So at the end of menstrual cycle, they undergo bleeding, and as their blood cannot be shed into the environment outside, so this blood organizes itself into the form of nodules. So you will see red-brown nodules or these implants. Sometimes these nodules grow to form large masses, and sometimes these endometriotic tissue involve ovaries and convert ovaries into brown colored masses. These brown colored masses are known as chocolate cysts. And lastly, you can see widespread fibrosis and adhesions. Why does this fibrosis and adhesions develop? You know that whenever there will be bleeding in the abdomen and pelvis, this blood will be organized by the development of fibrotic tissue. So this fibrotic tissue will result in widespread fibrosis and adhesions. So remember these gross features. You will see red-brown nodules or implants. You may see large masses. You may see ovaries being converted into the brown colored large masses called chocolate cyst. This is an important point for the exam point of view. Remember, the word chocolate cyst is hallmark of endometriosis. And lastly, you will see widespread fibrosis and adhesions. So these are the gross features. And as far as the microscopic features are concerned, they are really simple because you will see endometrial glands and stroma. But the special thing about endometrial glands and stroma is not about their architecture. Their specific point is about their location. That this endometrial tissue will be present outside the uterus. That is the definition of endometriosis. Now, what are the clinical features? The first important point to understand is that endometriosis develops in the woman of reproductive age. This is very important point for the diagnosis as well as for the understanding of this disease, that this disease develops in the reproductive age. And why this is so? Because I explained earlier that these endometrial implants are hormonal sensitive. They are responsive to estrogen, and this estrogen helps them to grow and sustain. And you know that it is the reproductive age where the production of estrogen is maximum. So the sustenance and maintenance of the endometriotic tissue is greatest in the reproductive age. After the reproductive age, when the levels of estrogen fall, then the lack of estrogen does not favor the growth of these endometriotic implants. So endometriosis is seen in women of reproductive age. Now let's see the symptoms. So endometriosis will result in dysmenorrhea and pelvic pain. What is dysmenorrhea? Dysmenorrhea means abdominal pain that develops during the menstrual cycle or during the menses. It can be abdominal pain or it can also be sensed as painful menses. Now, why does the pain happens during the menses? The reason is that, you know, during the menstrual cycle, during the end of menstrual cycle, when the menses happen and the endometriotic tissue from the uterus is being shed outside, these endometriotic implants also undergo bleeding. And as there is no proper channel for the blood to move out of the genital tract, so this blood accumulate in the abdomen and pelvis and can result in sensation of pain. So you will see dysmenorrhea and pelvic pain. The second important feature is intra-abdominal adhesions resulting in infertility. So as I already said, whenever bleeding happens in the abdomen and pelvis, the bleeding is ultimately organized by the development of fibrotic tissue. And when there is a lot of fibrotic tissue in the abdomen and pelvis, then this hard fibrous tissue will compress the fallopian tubes. So the whole architecture of the female anatomy will be disturbed. You can imagine that if the fallopian tubes are being compressed from outside by the development of hard fibrotic tissue, then the process of transport and implantation of egg or zygote is not fully there. So this can cause problems with fertility. So keep in mind that intra-abdominal adhesions can result in infertility. So you can see dysmenorrhea and pelvic pain, you can see infertility. And what are the other features? So this is the uterus, this is the cervix. Anterior to these structures are the urinary bladder, and posterior to this reproductive structures is the rectum. Now imagine that sometimes the endometrial tissue, which is normally lining the uterus, gets implanted in the serosa of the bladder. That is the definition of endometriosis, that in endometriosis the endometrial tissue grows outside the uterus. So suppose that the endometriotic tissue is involving the walls of the bladder, then during the urination it will cause pain resulting in dysuria. Secondly, it can also involve the walls of the rectum. The endometriotic tissue, when it involves the wall of rectum and it causes inflammation there, or it causes or it undergoes cyclic bleeding, then the irritation of the rectum will result in pain during the defecation. And obviously this endometriotic tissue can grow in the lower genital tract, can grow in the cervix, so it will cause pain and discomfort during the sexual intercourse. So dysuria, dyspareunia and pain on defecation are also the features of endometriosis. So this concludes the pathology and a brief clinical review of endometriosis.